many reasons why you may experience numbness and pins and needle sensation, but the three most common reasons would include elevated blood sugar. It can be due to vitamin deficiency, or it can be due to a compressed nerve in your spine. But which of these three reasons is the main cause why you're experiencing these symptoms? You need to know this to get to the root cause of the problem. That's why in this video, I will teach you a self-check that you can do at home right now to check the probable culprit of your symptoms. Stay with me until the end because you don't want to miss out on this important information. The three most common reasons why you experience neuropathic symptoms could include elevated blood sugar. It can be due to vitamin B deficiency, specifically vitamin B6 and vitamin B12, or it can be a compressed nerve in the level of your neck or in the level of your lower lumbar spine. Now let's do the blood sugar clue test. If the symptoms that you're feeling is caused by elevated blood sugar, you can expect symptoms on both sides of your body. It is symmetrical. Usually, the symptom would follow the stocking glove phenomenon or distribution, wherein you experience numbness and pins and needle sensation first in your foot, up to your lower leg, and lastly, your hands. You can experience burning sensation and hypersensitivity to your foot, such that even gentle pressure on your foot can feel pins and needle sensation. Or you can also experience the opposite, wherein you cannot feel the floor every time you walk or every time you stand. And although this does not happen to all, you can also experience cramps, because this is common if you have elevated blood sugar. And please take note of three symptoms. Ask yourself, do you always feel thirsty? Do you always feel hungry? And do you always have the urge to urinate? If you can relate to these symptoms, then there is a high probability that the cause of your numbness is due to elevated blood sugar. If you haven't had yourself checked yet, it would be best to have your laboratory to check your blood sugar level, because mind you, once you have regulated their blood sugar, most patients can experience improvement of their symptoms within weeks. Now let's check if your neuropathy symptoms is because of vitamin deficiency, specifically vitamin B6 and vitamin B12. You can experience symptoms on both sides of your body, plus you can experience memory lapses. You're getting more forgetful and you're getting more irritable. Can you relate to those symptoms? Some patients can also experience swollen and redness in the tongue known as glossitis, and some patients who lack B vitamins, they can experience tremor in the hands and the feet even if they're not doing anything. If you can relate to these symptoms more, then there is a high probability that neuropathy symptoms is because of vitamin B deficiency. Please incorporate in your diet food sources which are rich in B vitamins, such as your eggs, which are rich in vitamin B6 and vitamin B12, and your chicken liver, which is rich with vitamin B12. And you need it for the covering of your nerves, known as your myelin sheath. Beans is also an affordable source of B vitamins as well as folate. And don't forget your sardines and your milkfish, because it is rich with B vitamins, and it also helps with omega-3 levels that decreases inflammation in your body. Now, let's check if the reason of your neuropathy symptoms is a compressed nerve in the level of your neck and in your lower back area. These are the common levels where our nerves get impinged. So let's check. Symptoms usually present on one side of your body only. You can experience neck pain, shoulder pain, and even numbness in your arms and hands if the compressed nerve is in your neck. You can also experience lower back pain and numbness and pins and needle sensation in your leg and in your foot if the cause is a compressed nerve in your lower lumbar spine. You can also experience worsening of your symptoms if you sit for too long, if you stay in the computer for too long, if you carry something that is very heavy, or if you use the wrong pillow. These can all aggravate your symptoms. Don't worry if you experience these symptoms. Simple X-ray can already confirm your diagnosis. This way, you can receive more specific treatment that is suited for your case. If the cause of neuropathy symptoms is due to a compressed nerve in the spine, the most important thing that you need to do is to know the positions that you need to avoid. This is to prevent surgery. For example, if you experience neck pain plus numbness in your arms or in your hand, you need to avoid the stoop posture because these can actually aggravate your symptoms. If the cause is due to sciatica, you need to know about the certain exercises that will help decompress your nerve to prevent spinal surgery. Don't worry, I will place all the videos in the link below. Just click the ones that you need and the ones that can help you. So to recap, there are different causes for neuropathy symptoms, but you need to know the cause why you have those symptoms because that's the only way you can get to the root cause of the problem. If you're experiencing numbness and pins and needle sensation on both sides of your body, plus you're experiencing the stocking glove phenomenon or the stocking glove distribution, if you experience frequent urination, frequent hunger, and frequent thirst, then you consider elevated blood sugar as the culprit of your neuropathy symptoms. If you experience numbness plus you're getting more forgetful and you are irritable, consider vitamin B deficiency. And if you experience numbness plus associated neck and lower back pain, then the reason for your neuropathy symptom is due to a compressed nerve. If you have reached the end of this video, please comment down below which among the three causes can you relate more. And please don't forget, check the videos in the links below. I will put all the videos that I think can greatly help you. Thank you very much for watching. I will see you on our next video.